When cancer starts in the lungs, it is called lung cancer. Lung cancer begins in the lungs and may spread to other organs in the body. Report says that 90% lung cancer occurs because of smoking. Dr. Samir Singhal, the pulmonologist, gave information about lung cancer. Have a look at this report.
So basically, the lung cancer is increasing day by day, and its prevalence is now on an increasing role. Why the lung cancer is increasing? Because there's a lot of pollution in the environment, lot of carcinogenic substances which are there in the environment. The habit of smoking is increasing in young child also, and basically it is very important. I will tell you the symptoms of cancer later on, but the important point in this is that the teens are smoking a lot. They are vaping the liquid aerosols which contain the cancerous substances. They are smoking the e-cigarettes which are being there used by the teens, and it is all because of the either the peer pressure which is there to adjust in the society, or because of the advertisement by celebrities. So the important point is that should be cut. This is very important. The second important thing in lung cancer is that generally the lung cancer patient present us in a very late stage, and at that time it is in an incurable stage. So how we can diagnose lung cancer early? The main symptoms are if there is a change in character of the cough. So if the patient is having cough and the character of the cough is changed, or there is hoarseness of voice which is there in the patient, or there is blood in the sputum of a patient, especially those patients who are chronic smokers, then we should always think of that can be a patient of a lung cancer, and we should go for the early screening of lung cancer like chest x-ray or a low dose CT scan if we are having a high suspicion of lung cancer in those cases.
So don't you think that some symptoms are similar to TB?
Yes. The symptoms of lung cancer and symptoms of tuberculosis can be similar, because in tuberculosis also there will be cough, expectoration, there can be hemoptysis also, there can be foul smelling expectoration also. But the important point is that the lung cancer and TB can coexist. So even if a patient is having tuberculosis, his sputum is positive for TB bacilli, but if a patient is a chronic smoker, then it is very important that we should rule out lung cancer in those cases as well. So we should not sit quietly. If a patient has been diagnosed as a case of tuberculosis, we should rule out lung cancer in those cases also. And before, like in past few years, the tuberculosis treatment was given empirically without having a confirmed diagnosis of tuberculosis. But now we have a lot of investigations in which we can confirm whether it's a case of a tuberculosis or lung cancer. We have advanced diagnostic tests like CT scan, bronchoscopy, FNAC, ultrasound guided or CT guided FNAC, and we can go for those tests and can confirm whether it's a case of a tuberculosis or lung cancer, or having a coexistence of TB with lung cancer.
So how can we cure on ourselves, just avoiding this dangerous disease, lung cancer?
Right. 90% of lung cancers are because of smoking. So see, the very simple step is to stop smoking. So the government should take initiative in this case. The government should ban smoking all over India. That will be the first step. The second important step for curing or for prevention of lung cancer is that all type of advertisement by celebrities in which they give messages to the teens to chew tobacco or to inhale smoke, these all advertisements should be banned. The third thing is to take care of the environmental pollution, which is very important. And fourth is a healthy lifestyle.